Hi, my friends. Welcome back. And today we have a very special guest, the World Council of Optometry President-elect Peter Hendicott, who's going to be talking to us about myopia management and addressing that from many different perspectives all across the world and for very particular reasons. Let's listen in. Peter Hendicott, welcome to the program.
Thank you, Matt.
Well, we're pleased to feature you today and learn a little bit more about the World Council of Optometry, for which you're the president-elect. Can you tell us a little bit about that council and some of its goals?
Yeah, the World Council is essentially a professional organisation that represents optometrists across the world. I currently have roughly 40, give or take, member countries. So the countries are members. The WCO really aims at advocating for the role of optometry within the healthcare system. We run a committee that looks at legislation and standards to support countries to sort of progress legislation and expansion of their scope of practice or developing legislation if they haven't got it. WCO is a member of IAPB, and one of our members, Dr. Scott Mundell, is currently or just been elected to IAP's executive board, and we have a number of projects that people are involved in with the World Health Organization. One looking at competency standards, other looking at eye care conditions. So there's a range of it. The whole idea is to work so that optometry can position itself a contributor to improved health outcome.
And Peter, do you find that, as we move into the future, we've heard a lot about the myopia epidemic, for example. Is that going to require more collaboration between optometrists and ophthalmologists to get the job done as far as making inroads to manage that?
Look, yes. A prime role has to be taken by optometry because that's the refractive care component and the mitigation. So we're trying to reduce the number of people who become myopic by early detection and things that you can do to try and slow the development of myopia and then slow its progression. And where ophthalmology has a role to play, of course, is where people who develop higher degrees of myopia, who get the attendant risks of other ocular pathology that might be detected by optometrists, and in some countries could be managed by optometrists in some way, but in other countries has to be managed by ophthalmologists. So it needs to be a partnership. There's a role for both professions to play, finding early disease and preventing late disease through early detection and management, and ophthalmology's role with medical management where it can't be done by optometrists and surgery and so on. So it really has to be a partnership. There's no point in dividing resources. We have to combine resources.
And it looked like from last I saw, the WCO was kind of located in St. Louis as far as a base. So is America also an important sort of focal point for the WCO?
American Optometric Association is gracefully hosting the WCO's office within their premises in St. Louis and providing that sort of in-kind support. But WCO has its own staff involved in the office. We think about access to care. We think about factors that determinants of eye disease. There's social factors, economic factors, geographic factors, where people can't access care for economic reasons or geography. Those issues exist in both developing countries, but also in developed countries like the US and Australia, where there are populations who are unable to access care. That said, the level of care that's available in American optometry is quite different than in other parts of the world. They probably need less assistance from the WCO in progressing their case because they have a well-established association, a big membership. Where we look at the countries that are well-developed optometrically, WCO perhaps has a slightly less of a role in promoting standards of care in those countries. By the same token, they're the examples that other countries can learn from their experiences. So the WCO's role is to sort of bridge that connection.
Well, speaking of which, can you briefly describe the concept behind the World Council of Optometry's new myopia management online resource and some of the goals or aims of that website?
It stems from the standard of care resolution that WCO released partway through last year. That standard of care resolution statement aims at moving optometry away from purely correcting the visual acuity detriment that happens when you are myopic to managing myopia more broadly. Yes, we have to correct the refractive error to improve visual acuity, but we also have to prevent, where possible, people developing later degrees of myopia and becoming more myopic progressively, because that brings a higher risk of other disease, glaucoma, retinal detachment, and those sorts of things. And because the risk of those happens at low degrees of myopia as well, compared to people who aren't myopic. So it's not just, the high myopic people who get the nasties, if you like, but they can happen at other groups, and that's about the same risk of someone with high blood pressure having a cardiovascular accident. So, it's not an insignificant health risk for people who are myopic. So, and in some countries, optometry has the education and therefore the skills and knowledge to do that, and the ability through legislation to use certain types of lenses or prescribe contact lenses or use atropine or your myopia control method. Other countries, they're prevented in using some of the things, either because of the educational level or because of legislation.
When we think about this myopia management online resource, though, for those in our audience that don't know what that is yet, is it sort of a collection of documents that are supportive, or is it also things like online calculators? How would you describe it?
It's in its early development phase. We're currently working on the development of a number of practice information or infographics, if you like, for optometrists in practice that say, here are the things you need to think about if you want to look at people who might be myopic. Here are some things you can think about if you want to counsel children and parents about what they can do to limit progression, outdoor exposure, all those sorts of things. What management choices might you have? We're trying to take the research literature that's available, which is expanding rapidly as well, and putting it into a form where the everyday practitioner can pick up a page and say, oh yeah, that's what the research is now telling me in practice. Because not everybody can access research papers because of the way journals are managed. We're linking to the resource documents where they're publicly available. So if someone wants to actually go and read the research study, they can link and go and read the research study. But the aim is to have a series of support materials that a practitioner can use, both from a clinical investigation and management perspective and from a patient communication perspective to improve compliance with treatment and so on.
Now, Peter, earlier you mentioned differences, in countries in terms of the practice of optometry. And it seems like, for example, in Brazil, it's one of the most difficult areas in the world to attempt to practice optometry. I'm not even sure if it's completely legal. So how does a group like the World Council of Optometry be a catalyst for change, if that's desirable, in a country like Brazil? Or is the culture there unique such that there's very little that can be done?
We have to be asked by the country. We don't see it as our role to say, oh, country X is an optometric basket case. We need to go there and do something because that's inappropriate. We need to have the optometric organisation in the country to come to us and say, can you help us in these things? We've developed an overall document called Why Optometry, which sort of sets out what optometry's role is and what it can do. But we can help a country develop a specific argument to the health ministry, an evidence-based argument, which is important. It has to be evidence-based. If you have people who can do these things, they can contribute in this way to the health outcomes in your country.
Coming more from the ophthalmology arena over the years, it was interesting to me coming into optometry because while ophthalmology, you would have a society that's pretty established in most countries throughout the world, optometry, would be strong in some and not so much in others. Is there a path forward for countries that don't have maybe strong histories of optometry to figure out a way to institute the practice?
It first needs the different groups that call themselves, that claim to represent optometrists in a country, where there might be multiple groups, to actually be on the same page. You can't go to the government of Antarctica. I know I could use Antarctica because there's no optometry. Yeah. As an example, if you have the Optometrist Society of Antarctica and the Optometry Association of Antarctica and Optometrists Antarctica all have different viewpoints, you can't go to the government of Antarctica and say, you need to legislate optometry. You need to protect the public by determining who can practice optometry. Unless you have the same agenda. We're optometrists. We want legislation to protect us. That's not what legislation is for. Legislation is to protect community from people who are not qualified to practice. There are many countries who have examples of how they've gone through that pathway. And as I said, we've developed a legislative toolkit to support countries and associations who want to sort of start, who are on that journey, who haven't yet started that journey, to sort of work along that journey.
Fascinating. Well, recently I was appointed an ambassador by Orbis in order to help raise awareness of avoidable blindness. In doing interviews with different executives around the world, one of the interesting things that I realized was that, back in 2005, when I first went to China, most of the talk then was about, eradicating the cataract backlog. Whereas now I hear a lot more about myopia in conversations. And I suppose that's in part because there are risk factors when you have high myopia that could progress to greater disease. I think about myself as an example and needing, glasses when I got to be in high school and not really thinking that it was a major problem, being told by my parents, oh, it's no big deal. And that might be the case in many cases, but statistically, I suppose that there is a massive percentage of the world's population that does need some kind of treatment for myopia so that they don't progress to greater conditions. Is that all correct?
Yes, and that's part of our goal with this myopia standard of care and the website stuff that we're doing, and the goal of others who are doing similar things to increase that awareness. So there's a practitioner education component about saying, we need to do these things as a optometric profession in view of our healthcare role. There's an educative component to parents and public. You're myopic. We can do this, and this is why this sort of management is needed. An educative role to governments as well as to why addressing this is important from the point of view of future health cost. Someone developing glaucoma because they become highly myopic. Doing this appropriately can reduce later attendant health costs, both for the government and for individuals.
Yeah. So when we think about, all the different possible diseases out there, AMD, cataract, glaucoma, where does myopia sit in terms of preventing avoidable blindness, would you say?
Really, on a similar level. So if you can reduce the number of people who have myopia who develop or cataract, it relieves that pressure at the end of the progression scale. They're contributing less to the total number of people who have glaucoma or who have cataract. So it makes, if you can limit them to a lower degree of myopia where they're less likely to get those conditions, it eases burden on the health system for the people who develop them because of age, basically.
Well said. Well, Peter, thank you so much for joining us today. I feel it's been a really enlightening discussion across the board here today about optometry interfacing with ophthalmology, trying to conquer myopia and avoidable blindness. So wonderful to sit with you to discuss today.
Great. Thank you, Matt.